This video reviews air quality and its effect on dementia risk based on the publication from the Alzheimer's Association International Conference 2021. The studies published the evidence of the impact of air pollution on dementia is recently emerging, while the benefits of air quality improvement on the neurological disorders could be substantial. The studies used particulate pollutants, PM2.5 and PM10, and nitrogen dioxide, NO2 as measures of air pollution. The conclusion from the studies indicates that improving air quality and traffic noise increases cognitive functions and decreased dementia risk and mortality for older adults. The Lancet Commission's report of dementia in 2020. In dementia prevalence, if the potentially 40% modifiable risk factors can be eliminated. The modifiable risk factors include air pollution. Other risk factors: hearing loss, less education, smoking, depression and social isolation, traumatic brain injury, hypertension, physical inactivity, alcohol over 21 units per week, obesity, and diabetes. This is the first study that aimed to quantify reduction in air pollutant, PM2.5 concentration leads to dementia incidence benefits and the benefit of air quality improvement interventions on the reduction of dementia incidence. This study used the French 12-year follow-up dementia diagnosis 7,051 participants with median age of 73 between 1990 and 2000. The study quantified the effects of hypothetical interventions to reduce PM2.5 exposure on dementia risk. The authors of this study conclude that the possible substantial benefits of reducing air pollutions in the prevention of dementia. This study examined the long-term air pollution exposure in plasma amyloid levels in older adults aged 75 years and older from 4 U.S. communities. Plasma amyloid beta levels were measured with the air pollutants, PM2.5, PM10 and NO2 at 3,029 participants' residential addresses. This study found that a higher PM10, PM2.5, and NO2 over 10 years was associated with higher levels of amyloid beta. This study concludes that long-term air pollutants are associated with increased amyloid beta. The findings indicate that air pollution may increase Alzheimer's dementia risk, as evidence support that amyloid beta is a crucial factor in Alzheimer's disease. This study used the U.S. community-dwelling older women aged 74 to 92 for a period 2008 to 2018. It examined the association between air quality and cognitive function. The study assessed using the cognitive status modified and verbal learning tests and the PM2.5 and nitrogen dioxide at residential locations of the participants. They found that improving air quality increases cognitive functions with 0.9 to 1.6 years younger regardless by region, education, ApoE4 genotypes, or cardiovascular risk factors. The benefits were reduced after excluding incident dementia cases but remained after excluding stroke cases. The study concludes that long-term improvement in air quality and late life was associated with slower cognitive declines in older women. This study used Medicare data of health conditions 1 year before death in persons 65 years of age and older between 1990 and 2003. This study from Canada found that individuals over 65 years with certain health conditions, especially those with diabetes and cardiovascular disease, hypertension, atrial fibrillation, and cancer, may be susceptible to the short-term effects of air pollution. World Air Quality and Pollution Index, published on the 16th of March 2022, shows the worst top 20 cities of air pollution index are mostly located in Asia and South America except Poland, Kazakhstan, Nur-Sultan, followed by Bangladesh, Dhaka, India, Mumbai, Kolkata, and Delhi, China, Hangzhou and Wuhan, Pakistan, Lahore, Indonesia, Jakarta, Myanmar, Yangon, Nepal, Kathmandu, Thailand, Chiang Mai, UAE, Dubai, Taiwan, Kaohsiung, Kyrgyzstan, Mexico, Mexico City, Chile, Santiago, Wrocław, Warsaw, Poznan in Poland, Bishkek, Wrocław, Warsaw, Poznan in Poland. Local and national level policy is required to improve air quality in these worst-case countries rather than individual level protection of wearing mask. This Denmark study, published in 2021 in the medical journal, BMJ, examined the noise pollution on the risk of dementia. It aimed to answer the question, could living by a busy road or near the train tracks put you at higher risk for dementia? Using 105,500 cases of dementia among adults over age 60 from 2004 to 2017 living in areas of high traffic or railroad noise for a decade or longer had a higher risk of dementia in general and a 27% increase in risk for Alzheimer's disease compared with those who lived in quieter locales. The study also found that people living in high-traffic noise areas were also linked to a higher risk of vascular dementia that caused by reduced blood flow to the brain from plaque buildup in the arteries. It is indicated that traffic noise may affect sleep quality or cause an increase in stress that affects brain health. The findings suggest the importance of public programs to lessen noise pollution. A study published in 2013 estimated the monetary values as a value of a prevented fatality, a flow of discounted value of life years lost, for risk of death from air pollution exposure. The study used a French air pollution survey that provides a description of the life length reduction implied by a change in air pollution exposure. The estimated mean value of life years lost are €140,000 at the 2001 price level. The mean value of €140,000 is proportionated a 30% premium for value of life years lost in average expected health status. Summary: key results in the recent studies found that air quality improved greatly over 10 years and that the risk of dementia decreased up to 26% in older U.S. women, and reductions in the risk of dementia in French people by 15%. Long-term exposure to air pollutants was associated with higher beta-amyloid levels in the blood in a large U.S. cohort, showing a possible connection between air quality and physical brain changes that define Alzheimer's disease. The results demonstrate the importance of policies and action at local, national, regional, and global level that address reducing air pollutants.